shows unprecedented national progress in the systematic reduction of adverse drug events in all acute short-stay U.S. hospitals. Accepting this award, video time.
The 2016 Pinnacle Award for Voluntary Health Agencies, nonprofit organizations, associations, government agencies, and public and private partnerships goes to the United States Department of Health and Human Services. Various government entities within and outside of HHS, as well as private sector groups, came together to create a program to systematically reduce the number of adverse drug events in all 5,000 acute short-stay hospitals throughout the country.
So the AHRQ National Scorecard has shown that there's been dramatic reductions in adverse drug events throughout the country. In terms of hospital-acquired condition reductions, we have seen 2.1 million events averted, 87,000 lives saved, and $20 billion in savings between 2010 and 2014.
I think, some of the successes that we've seen, in addition to the AHRQ National Scorecard results, we've seen an avoidance of over 44,000 potential adverse drug events, and we've also seen our patients improve on their hemoglobin A1C, improve on monitoring for medications that need monitoring, such as INR for patients who are on an anticoagulant, and a reduction in inappropriate antipsychotic medication use.
Over and over again, we heard patients say that this pharmacist made a difference in my life, they made me feel better, and they were able to get me to goal, and that they had never experienced anything like that before.
I think it's a really good example of pharmacists as, again, collaborators, coordinators, teachers, helping to get the patient the right care that they need.
I would just say that I'm truly honored to be a part of this team and this work. It's also been great to see the work continue. We really started this work back in 2008, and we had the vision for it to continue through public-private partnerships, but to really watch it happen and to see it continuing years later, I'm so proud of, and it's great to be a part of that as part of this Pinnacle Award.
Accepting this award on behalf of the United States Department of Health and Human Services is Mr. Jack Austin Jordan.
I think the other people had more time to prepare remarks than I did, since I didn't know I was coming up here until just now. But the time I had at the Department of Health and Human Services was really life-changing, and it was amazing that the scope of what the federal government is capable of doing is truly amazing, and the number of really talented people that were putting their heart and soul into this. I was personally involved with the Partnership for Patients, and you saw a few broader kind of things going on more in the outpatient setting, but I think we tried to challenge every hospital in the United States to really think about broadening what they're doing with patient safety. When we started this, very few hospitals did much with tracking INRs above 5, other than treating it as an event. They had to make sure they followed up and talked to the physician that it happened, but started to really say it's very actionable. Someone's already doing that. You can start tracking it in the system and method, make a difference in this. So we really tried to be scrappy and do everything we could to challenge people to say you don't have to have some really expensive electronic system, though that's what I'm building right now. But you can actually just do what you can with what you have, and you can make a difference. And I think the challenge of doing that at scale and seeing people make the difference that can happen when you have such a large group of people working on this was really amazing to watch. And I'm really thankful for all the people at HRQ who had a wonderful tracking system so we could kind of measure our results nationwide. And again, the hospital contractors that we had working with, 3,700 of the 5,000 hospitals, really getting them engaged in this work. So it was truly a wonderful aspect of my life to get to do. And it was just wonderful to be part of an amazing team of people who really are trying to do what's great for this country. So thank you very much.
Good job, Jack.
Congratulations to these outstanding 2016 Pinnacle Award recipients for demonstrating quality in the medication use process, all making a positive, lasting impact on the standards of health care across the country. And many thanks for all of you.